Hey everyone, I'm Wardy with Traditional Cooking School, home of the Eat God's Way cooking program, and I'm here today with Carrie R. Hi, Carrie.
Hello.
And we're here today so Carrie can share her story. It's going to be a lot focused on her husband because he's had an amazing transformation with his health as they've journeyed through Eat God's Way. And so, just to start, Carrie, tell us a little bit about you and your family.
We've been married. It'll be 30 years this December, so I'm excited about that.
Congratulations.
My daughter is 20 and she just completed her first year of college, her freshman year, and my son will be 10 in a couple of weeks. So we have two children, and I'm a nurse at our local hospital. I work as the emergency room nurse, and my husband is a jet mechanic, so he's pretty active in his daily routines. He's always up and going. We started our journey with traditional cooking a couple of years ago in 2022. So we kept a normal American diet, what you would see nowadays. We didn't really consider too much about, we knew we needed to eat low fat or those kinds of things, what you hear in the hospital, the American Heart Association, all those diets
Yes.
where you're supposed to low salt and low fat, all the things that they tell you. But my husband has a history in his family with diverticulitis, and he knew that
Yes.
eventually his time was going to come about. And so we just didn't really pay attention too much to our eating except for when it happened, right? So in January of 22, he had those symptoms, severe stomach pain. He had a low-grade fever. He was just curled up in pain. And me being the ER nurse that I am, in January, you have the stomach bug with a fever. And I said, if you still have a fever in the morning, let's go to the hospital and get it checked out, right? So it was just like, let's wait, because it was a low grade fever. So it wasn't too terribly alarming. So he went to his doctor instead because the fever went away, but he was still having some pain. So he just went to his outpatient visit, which is good. But I believe God has a reason for everything that happened in this. Without him, the story wouldn't be as
Sure.
successful as it was, because it's all glory to him. He went to his outpatient doctor. They set up for a scan of his stomach. And of course, he's usually off on Fridays, so he wanted to schedule it for a day that he was off, so that it had to be a couple of weeks later. So I'm thinking, oh, he's not in pain anymore then, I guess. And so it was a couple of weeks before he got a scan. And of course, the doctor started him on antibiotics, knowing his history. A couple of weeks later, we get the scan, and the radiologist notified him instead of the doctor. Thought that was kind of funny. And he said, there might be a perforation in your bowel, and you need to talk with your doctor. This was late on a Friday, so we didn't end up talking to the doctor until Monday. And of course, I've seen the symptoms. He was doing better. He's walking. He's going back to work. I'm thinking, this is obviously not accurate. This is not who he is. He's no symptoms at that point. So I said, okay, we'll talk with his doctor and see what he says. And so the doctor ordered another round of antibiotics. And so now his gut is just getting all torn up and severe pain, which we ended up on Valentine's Day getting into the ER to say, can you just take another look and see? Because there was a possible perforation, and now we're not sure what's going on. I'm working in the ER, so I have a close relationship with the doctors. I remember the doctor showing me the scan, and he says, they don't see a rupture, but you see this little cloudy stuff over his bladder. I don't know what that is. And I was kind of, okay, I don't either. But he started him on some more antibiotics. And so about that time, I had discovered traditional cooking, and I'd been learning about sourdough, and I had been learning about going on a lower gluten diet, and I'd learned about einkorn and how is it a lower gluten index where it's not as
It's a gentler gluten and a
right.
gentler starch. Mhm.
Right. And so my friend had recommended that, and she was teaching me about sourdough, and she introduced me to your courses on traditional cooking. So at that time, I was like, we need to really look at this. And so we started looking at all the things. I knew about bone broth. Some other friends had told me about bone broth. So I had that in my freezer. When he had the flare up originally, we had the bone broth available. So I told him, just start drinking some bone broth. So all the while, he was drinking the bone broth whenever he had the flare ups. But everything that I was learning with traditional cooking was just pointing me like the things that we were eating, the low fat diet was not accurate. You need to have traditional fats. The salts in our diet, I've always been preaching the low salt, and it's actually the real salt. And we actually need more salt than what we actually consume in certain cases. Let's see, where were we? We were in the ER on February 14th, Valentine's Day.
Yep,
And so
Valentine's Day.
that was memorable. He was discharged and he followed up with his GI doctor, which wasn't until March that we were able to get into the GI doctor, and we set up a plan for surgery. So this has been a long process. And he had several flare ups from January till it was like every 2 weeks he had flare ups. So as I studied more about the traditional diet and just changing, doing more bland cooking, doing the traditional fats and things, we kept bone broth on hand all the time. That was one of the things that helped him in the recovery process because, like I said, the CT originally, there was some question about possible tear or rupture in there, and then the cloudiness. So he made it to the surgery. Thank you. We didn't have to go in for an emergency surgery. He went in for surgery, and the surgeon said, yes, it was absolutely necessary that we needed to remove this bowel because there was a rupture and it had sealed off into the lining of the bladder. And so that was the cloudiness that we saw. And I was like, I don't know how that happened. That had to be God's working because I've never seen that kind of case before. I give him the glory, first of all, but I think that this traditional cooking and the methods used with the broth and just using the healthy fats and the sourdough and being more traditional cooking, that was our go-to. That helped us through the whole process. And it's been a couple of years. It's been 2 years. So he lost quite a bit of weight and he's healthy.
So he had a crisis in January 2022, and it took till March for him to have the surgery. And all along, it was like there could be a perforation, and there's this weird cloudiness. So it turned out that there was a perforation, but it sealed up, which was not normal.
Right.
And during that time, the bone broth was very soothing for his flares because the
Right.
process just took so long to like, well, what actually is going on and dealing with
Right.
it. And then meanwhile, you were looking into traditional cooking and you were thinking, I've got salt wrong. I've got the fats wrong. Bone broth is soothing to him. I already knew that, but maybe there's more we could do. So am I summarizing it to that?
Except for that, he didn't have surgery until May. We went from
Oh,
January to
May.
May. We saw the GI doctor in March and scheduled the surgery, but it wasn't until right after Cinco de Mayo that we went in. So it was
All
early
these
May.
holidays tainted
Yes.
with the medical memory. So exactly what was the surgery? Because this perforation had already sealed. So
Right.
did
So
they
they
remove
removed a
or
portion of his colon, the lower portion of his colon. They removed that small portion that had that rupture, but it adhered to the bladder. And that's what that cloudiness was around the bladder. It was adhering to that.
and did it affect the bladder at all? Or they
It
basically were able
didn't.
to
Praise God,
perforate?
he came out without having to have a GI bag, a colostomy bag. He did not have to have a bladder bag. Just all these things. You have your worst nightmares. I'm sitting in the consult room with the doctor after surgery, and I'm asking him, is his bladder affected? Does he have a bag? Just all the things. And he
You know
was
what to ask for.
Yes. And so I knew that this could have a worse outcome because I knew that cloudiness around his bladder. There was something wrong there. He showed pictures and he's like, I'm so glad we got this done because there was a rupture. Truly, I believe that it happened in January, the night that he had his fever, because that was the only time he had his fever and he had the doubled over
Sure.
symptoms. So I
Yeah.
believe that and then the symptoms relieved. I was kind of like, this is questionable. So we changed all of our cooking strategies and the foods that we buy. Before traditional cooking, I kind of scoffed at, organic, that's just a higher price, or that's silly, that's just some kind of gimmick. And now I'm a believer. I'm going to buy the organic foods, grass-fed beef. We make sure if we're going to cut out our grocery bill, it's going to be the junky snacks. We don't have to buy all the junky snacks and all the sugar and all the things that we've been putting in our grocery bill. We used to have bread. It's funny because we never paid attention to it before, but we had sandwich bread on our counter for like weeks and weeks on end. But I make a loaf of sourdough bread and it goes bad within a couple of days. And my husband looks at me and he goes, that makes you kind of wonder what's going
What
on.
what are they putting in this bread?
So
Preservatives.
yes. So he actually enjoys it. Took a little bit of the change. What is this? How is sourdough going to actually help? And it actually did. Just that change. I'm not saying we're completely gluten free, but just the change in how we do our grains, soaking the rice, soaking the oatmeal. We did a lot of soaking oatmeal because after surgery, once his GI tract healed, he needed to have a high fiber diet. So oatmeal was one of the things. I would get up and we had a routine. I just just soaked a large amount of oatmeal, and then we would have it for the week. We cooked it, and that's what he would have on his breakfast. And he would put honey in it instead of sugar. We changed our sugar, but we use less of it now. And so he was using honey, and that's a natural healer. I don't know all the things, but yes, it has a natural healing property in there. So we use honey more. In fact, he doesn't use sugar in his coffee. He drinks less coffee. We used to use coffee with creamer. We don't. We just drink it black if we drink it, those kinds of things. I did the course on fermented foods, and he loves he loves the fermented, we call it pico de gallo. I think it's salsa in the
Oh,
fermented
yeah.
foods. He loves that. I try to make that pretty often, but I haven't in a while. But we try to have the fermented foods around just to give him some probiotics in his gut. We've enjoyed making the cheese. In fact, including my son on the journey, he's enjoyed learning some of those things. So he loved dripping the milk to make the cheese and just seeing all that. So that's been a fun journey for him. But they like the crackers. That's their favorite. The waffles and the crackers are our favorites for using the sourdough starter. And so I try to keep those around pretty often so that we can cut out the junky snacks and have good snacks around. In fact, my daughter, so we homeschool, and she would go to community once a week. And so my daughter, when she was in her upper level high school age, they would always take snacks and share with the group. So she would take the cheesy crackers to
Yes.
class, and like everybody would just swarm in on her. In fact, the pastor of the church that we were at, he's like, before we have our conversations, do you have any crackers? So it was making him pretty regular. Yes, that was the thing. Before we go to community day, we had to have those crackers so she could share. So those were
Required for entry.
yes. So that was kind of fun. They love that, having that around instead of reaching for like potato chips or whatever. We have those, try to keep them around. And they're not hard, and they're fun to make. I got the little ravioli cutter, so it makes the little jagged edges.
Oh, yes. The
I tried
wavy.
making the little goldfish, but it kept getting stuck in my little punch. So I didn't. Yeah, I tried using a little goldfish cutter to make them like the goldfish crackers. I just said, forget it. We're not going to. That's too much.
It still tastes good as wavy squares.
Exactly. Before I even have a chance to actually let them cool off and put them away, they've already scrumptious them up. Scrumptious, I don't know if that's a word, but that's what happens.
It is now. You already knew about traditional cooking, but you had your husband's flare up in 2022 January. So that was like your canary in the mine episode to really change a lot of things. You've just done so many things. Talk to us now about your husband's other health issue
Oh,
that
yes,
came up.
that's right. We've been walking this journey for a couple of years now, but every now and then you slip back, especially around holidays when you go around family and they're not cooking.
Yes.
So holidays come and we're home with our family eating all the junky foods that we love so much growing up that you're miserable afterwards.
Yeah.
So his cholesterol level actually spiked up because he had lost all the weight and we were doing really good with our traditional cooking, but Thanksgiving and Christmas and being around family. We love family so much. But my mother-in-law is the one that cooks. And so she loves to cook. That's her love language, is to cook for people. And so you just have to have these recipes. It's not Thanksgiving if you don't have these recipes. It's not Christmas if you don't have these things. And so we slipped a lot with those couple of months of holidays happening.
This was 2024, just the most recent holiday season?
Yes, the most recent holiday. It's been a couple of years since surgery, and he's doing all right, and he's active, so things are good. And so we start slipping back. And then come January of 25, he goes in to get his blood work. Surprise, your cholesterol has gone up. And so the doctor wanted to put him on some statins for his cholesterol. And I was like, I don't think so. He ordered them. He prescribed them. My husband picked him up because the doctor said so. And I was like, I'm sorry. I don't want to go against the doctor, but I'm going to give you this video and this video that my friend, who's also a nurse, who I also worked with as an ER nurse, and now we do other things together. And I told her about it. She goes, Carrie, I've been doing the traditional path too, and the more homeopathic, and I do not like what's going on in the healthcare system. I'm not a professional as far as prescribing medications. I just know that the things that you see, I wasn't very excited about the statins. There's more bad than there is good. And especially with my husband has been on statins before, and he just never really had a good outcome with them. He never really had this, wow, your numbers dropped this is working out great. It's just like they're there. And I think they caused more harm than good along the way. So anyway, I just said, let's just get back on our diet the way we were, make sure that we're doing the things that we're supposed to be doing. I know for a fact if we just follow the traditional path the way we're supposed to be doing it and not cheat like we have been doing, I think we can correct this. And so in May, he went to get it checked out and his numbers dropped. His bad cholesterol went down and his healthy cholesterol was great. And so I don't know the numbers. I meant to get the numbers so I could have an actual value for you, but they went down significantly. And so he went in and the doctor says, just keep doing what you're doing. And he just didn't have the heart to tell him that he wasn't taking the statins, which I'd like to get us started with a more naturopathic doctor or one that's less big pharma. And I would rather not do pharmaceuticals if we can help it and try to be more natural. They all have a place, but like a last resort.
Last resort, right?
And I think I see them more and more. A patient comes to the emergency department and they automatically get prescribed an antibiotic when they really don't need. They could just ride it out and do some traditional methods to just clear up what's going on. So it's sad.
I bet you see it all.
Yes. And then there are some doctors that come through that stick to, you need to go home and try some elderberry and take some tea with honey and lemon. And I'm like, thank you. Thank you. That's what we need to do.
Congratulations. That's wonderful about your husband. I want to say you mentioned the word cheating over the holidays. So many people do that. I wasn't there, so I don't know what you did, but I have a feeling this is what you're talking about, the real backslide. Whereas on a daily basis, a few little cheats is not going to tip you over. Right. So we're talking like the 80-20 rule here. You got to be good 80% of the time and you'll make progress. How rewarding that you did it. He did it.
He did.
Now, next time he can tell his doctor, I'm not actually taking the statins.
Right.
To be a testimony. Then the doctor might ask. I've heard from students and they're like, I tell my doctor that I didn't take the medication. They're like, well, just keep doing what you're doing. But they don't ask, what did you do? They're not interested.
I know. They're the professional and they know and they have all this background, but really their training is a little skewed as far as what pharmaceutical companies want them to say, I think, a lot of times.
And I know they're strapped for time and they see so many patients and the business model is not set up for them to do unorthodox things. It's just like the checklist. This is what we do. If you want to do something different, then if it works, okay, but I'm just going to keep following this checklist. Well, congratulations to you both. That was fantastic. Now, I'm so curious, you being a nurse, you have one that you're still homeschooling, you're doing all this cooking. How are you balancing all that?
Sometimes my balance gets a little off balance. I had to step back a lot from the emergency department. I really only am working about one night every other week. I'm a what we call PRN. So when we're actually actively homeschooling during the school year, I'll just work one night because my daughter's not home and she was the one that I depended on for childcare if I did work. So I just work one night every other week just to keep up the skills and keep active. And then I am also just homeschooling most of that time. I do have a bad tendency to overextend myself with other things like activities at church or activities in our homeschool community. And then next thing you know, I've become so busy that the traditional cooking tends to take a backslide. And so that's where I've got, we got to cut out some of these other things so that we are not endangering ourselves or harming ourselves. And I tell my daughter all the time with diverticulitis, women are more susceptible than men. The only thing is with my husband's background, there were 3 boys in his family. There were no girls. And so it was his dad that had it. And then, of course, 2 of the sons had it. The oldest son wasn't actually my father-in-law's son. So the 2 brothers had it. But if you go past my father-in-law, the women, the sisters had it. So my husband's aunts had diverticulitis also. So women are more susceptible. So I tell my daughter, it's very important that you eat a good traditional diet, not just for your GI tract to be regular and healthy, but also to manage your stress. You're in college. And to keep the anxiety level down, you've got to just plan well. These tests are coming up, so try to eat healthy. So that way, when these high stress levels come up, you're better prepared. So
Yeah.
hopefully that will stay with her. I'm trying to keep her encouraged, but also to myself, I've got to remember and be an example. I noticed that over the summer when I get busy, summer is our busy time with helping other homeschool families know that they can homeschool, and I do a lot of equipping sessions. So then I start tripping up on my diet, and every time I do that, I have been looking into the allergy. I don't know if you can tell my congestion is flaring up again. Whenever the weather rolls in, the congestion just flares up. But that has to do, I think, too, making sure I have good sleep and making sure I'm eating right and
Yes.
not eating out like fast food out, not just going out to eat and eating decent meals out to eat, but just junky foods while you're eating out. And so, how am I managing?
Sounds like you're managing quite well.
We're trying.
Realistic. Yeah, yeah. You're sticking with it, not expecting perfection, because that's when we
Right.
trip up. We just have to do the best we can. And the nice thing that I'm hearing from you is that your bodies are giving you the signals and you're listening. And so then you're like, oh, I'm letting things slip. I got to get back on track. And one thing is, not everybody's sensitive to those signals. And the other thing is, not everybody listens. So you have two things going for you.
So that's exactly. They say we are what we eat.
We
It's
are.
if we're going to put
Yeah.
in the bad, then it's going to come out somewhere and affect
Very
us.
good. Well, thank you so much for sharing your story, Carrie. Congratulations to you and your husband, and I'm so proud of you.
Thank
And
you.
I appreciate you taking the time. Do you have any last words before we sign off?
I just want to say thank you. And I really appreciate just the encouragement, the weekly encouragement. I just feel like sometimes your emails are like, they're specific to me. She's writing
That's
this
nice
email
to
to me.
hear.
She knows. Because they're like right spot on a lot. So I'm excited. And then the office hours are encouraging as well. I try to make that time. I had been skipping out, and then I realized those are the times where I need the encouragement. It's just 2 hours a day. I mean, not 2 hours a day,
A
2 hours
week.
a week,
A week.
right?
Yeah.
And it's just one day a week. I can schedule a hair appointment. I can schedule doing all these other things. Then I can schedule this time, set my son up with his own work, his own activities so that I can be part of this call so that I can better our health. And so I had been like, oh man, that's a 2 hour call. But really listening to you and Holly and the encouraging and the medical background that Holly
Yeah.
provides, that's very beneficial. So I really
Right,
enjoy
right.
it. And hearing everyone else's conquering overcoming certain things or mastering things, that's encouraging. You can do it.
It sure is. Yeah. It's the highlight of my week for sure because we can feel so alone and like we're walking this journey and there's nobody else on it. But then we take the time to go. Of course, I have to be there. And it's just like, no, I'm not alone. There's all these
Right.
other families on this same journey and they're struggling and they're having wins. And I learned so much. It's so inspiring. So thank you for taking part.
Thank you. I enjoy it. I appreciate you having me and just talking with me a little bit about our journey.
It
Thank
was
you.
great to hear your story. Thank you, Carrie. And for everybody listening, if you feel like you have stubborn health issues or you need help just making healthy cooking happen in your family, and specifically traditional cooking that makes foods more nutritious and digestible, there's information with this video on how to contact us. So just reach out and we'll let you know what current classes we have going, enrollment dates, and how everything works, even to go over your situation with you to see if it might help you and your family. Thanks, everyone. God bless you. Bye bye.